Hello, I'm Anoop Shah, clinical academic at University College London and this institute postdoctoral fellow. I would like to tell you about a project I've been working on to improve the problems and diagnoses in electronic health records and some learnings from developing guidance in this area. The patients I look after in the internal medicine unit often have complex medical histories. It can be difficult to grasp a patient's current diagnoses the first time you meet them, and often it involves looking in long narrative notes and trying to piece together the information. But why are diagnoses recorded in such an unstructured and difficult way? Partly because the doctrine of the method for doing so, so-called clerking a patient, only really applies for the first time you see a patient and is designed for a very thorough assessment. It's not particularly helpful for ongoing care of a patient, where you need to document changes to diagnoses over time in a consistent way. In the 1960s, the US physician Larry Weed proposed the idea of a problem-oriented medical record, where each diagnosis is listed in a problem list and is linked to information about it. Modern systems allow clinicians to create problem lists, but they are often incomplete. In the COVID-19 pandemic, in my own hospital, only 63% of important health issues for inpatients with COVID-19 were recorded on their problem list. Another problem is that the record systems do not join up very well. In the UK, the GP's problem list may not include much detail, which is often hidden away in the narrative notes and specialist notes. Data collections for registries and for research are often separate from clinical care and involve wasteful duplicate data entry. So how can this be improved? We clearly need better health record systems, but we also need to define what best practice is, so that systems can be designed accordingly. However, prior to this project, there was no consensus written definition of best practice in recording diagnoses. The Professional Record Standards Body, PRSB, and the Royal College of Physicians Health Informatics Unit therefore commissioned a project to develop guidance for health professionals in recording diagnoses. I was the clinical lead for this project. We found that existing systems in the UK varied quite widely in the way they could record problems and diagnoses. We drafted a guidance document based on a literature review and carried out an online survey of clinicians and informaticians, and subsequently held a roundtable discussion to discuss issues that were raised in the survey. Some issues generated a lot of discussion, such as how to classify the certainty of a diagnosis and how best to share diagnosis information between hospitals and GPs. I organised a patient workshop to explore patient views on this topic, and they were keen for a structured framework in which diagnosis information could be shared while maintaining its provenance. We have published the guidance, and next steps are to pilot it and develop standards for improving systems. I'm currently leading a diagnosis recording special interest group of the Faculty of Clinical Informatics. We held introductory webinars in December 2019 and are now working to define principles and models for designing electronic health record systems to record diagnoses. So what have we learned about developing good, effective guidance? First, guidance needs to be high quality and evidence-based and represent a consensus view of best practice. Second, it has to be feasible to use in practice, and it has to be developed in conjunction with end users. Third, guidance should come from an authoritative source. We are working to seek endorsement of our guidance from the Academy of Medical Royal Colleges. Fourth, guidance that is mandatory or has financial incentives may be more likely to be implemented. And finally, and most importantly, end users need to appreciate the benefits of the guidance. In our hospital, local champions encourage the use of the problem list, and the acute medicine department runs a leaderboard competition for junior doctors. Therefore, the most effective way to improve diagnosis recording may be to enable clinicians to see the benefits of better quality data, as the greatest reward for a clinician is to be able to improve the care of their patients. Thank you for listening.